Hello, and welcome to this lecture on quantitative data collection for program evaluation. At the end of the lecture, you should be able to identify and describe the approaches for quantitative data collection, understand and explain the concepts of reliability and validity in quantitative research, and how to ascertain these and to describe the functions of an institutional review board. So, answering the research question requires using one of a variety of approaches, all of which would require the collection of data. So, data collection for the process of evaluation requires reviewing financial statements, audit reports, travel documents, invoices, contracts, administrative logs, participation logs, signing and activity sheets, training logs, meeting notes, and surveys. So, data collection for outcome evaluation requires a number of specific and deliberate data collection steps and activities at the beginning, during, and at the end of the initiative. Such data collection involves quantitative as well as qualitative approaches. So the second step of the participatory model for evaluation is to collect the data as shown in this figure, which we have been using in this course. This and the next lecture focus on collecting and analyzing quantitative data to answer the research questions in either process or outcome evaluation. So applying the community-based participatory research principles to quantitative data collection requires paying particular attention to the participation of stakeholders in the conceptualization, development, as well as implementation of the methods. In both the quantitative and qualitative data collection, the approaches used to collect primary data should be the most appropriate for answering the research question and should always be based on the needs of the project. So the data collection for a simple pre-post test necessitates different expertise and training and approaches than the data collection for a quasi experimental or experimental design. The most appropriate approach is the one and most likely to provide valid and reliable data. A number of factors influence the credibility of the data that are collected, including whether appropriate methods are used, whether multiple methods are used, and whether the sources from which data are collected are reliable, whether theoretical frameworks for developing the data collection instruments are used, and if the biases associated with the recruitment of the study participants and the data collection methods are minimized, whether the quality and the quantity of the data collected are sufficient. So, important considerations for both quantitative and qualitative research are the characteristics of the study participants, which may influence the approach that is selected. So the approach selected should also ensure the right of the individual to respect and fair treatment. So consideration must be given to the respondents' culture and their cultural values, to their educational level and preferences, their age, their gender, the race or ethnicity, and their accessibility and availability, and the respondents' access to computer technology, telephones, as well as their right to refuse to participate in the study. So the availability of resources also influences the type and the duration of the monitoring, and the type and quality of the conclusions. And so the better the quality of the data, the more valid the conclusions. So factors that influence the quality and the quantity of the data includes appropriate and effective staff support, the language capabilities for conducting culturally sensitive interactions and interviews, and logistic support for project management and data collection, time allocated for completing the study, the technological capabilities for data collection and analysis, the availability of stipends and incentives, and possibilities for translating instruments and transcribing interviews and entering, coding, and analyzing the data. So surveys are the most often used data collection tool for quantitative research and designed to collect information from those who experience or have a personal insight into the issue being assessed. Individuals may be members of the community and affected by the problem, as in health assessments, or they may be providers of the services. Key informants who see the problem from their own vantage point but have considerable insights may also be surveyed. Using surveys as a data collection method has several advantages. So constructing items for a valid and reliable survey can be a difficult and time-consuming exercise, but once the items are developed, they may be used over and over again for similar projects. Secondly, surveys are relatively easy to administer, and they collect a large amount of data in a relatively short period of time. And also, surveys can be evaluated for reliability and validity. Furthermore, surveys lend themselves easily to community-wide data collection efforts. And they also, written surveys can be administered in groups or individually by mail, face-to-face, by telephone, or electronically. And so surveys are generally less expensive to administer than other research methods. So there are several considerations in opting to conduct surveys. One of them is that surveys collect large amounts of data that provide some information, but often leave the researcher asking why or so what. And so surveys have to be just the right length and long enough to measure the concepts accurately and ensure stability of the measure, but short enough to be completed fully and not burden the respondents unduly. Another consideration is the time or expertise it takes to develop a reliable and valid instrument, and because these may not be available. Survey administration can take a long time to complete as respondents may not respond to a request or complete it face to face, open their mail for a mail-in survey, and they may not answer the telephone or respond to an email request. So getting the survey completed may take several attempts at contacting the potential respondents through reminder postcards or multiple phone calls and emails, and are spread over an extended period. So survey may be used to collect information in a community assessment as baseline data before or at the start of an initiative, and in assessing the process or outcomes of an intervention. Like all other measurement tools, they can be used in any of the evaluation research designs. Often they are used when there is no specific research design. So surveys require a considerable amount of skill to develop and analyze. A student once had this to say about the process, and I quote, he says, although it could take multiple hours and many drafts to develop your survey or questionnaire, it is best to put the time into creating it, and this will make the remainder of the process go a lot smoother. So maximizing the potential for the survey to provide the best information requires engaging diverse stakeholders in the conceptualization of the survey, the identification of specific survey areas and items, the selection of survey language and the wording, and the approaches to survey administration. In addition, a variety of activities can improve survey instruments. These include using expert panels to assure appropriate and complete understanding of the concept being measured. And we might also use pilot tests with the potential study population to ensure a good understanding of the survey items. There's also the possibility of incorporating tests of validity and reliability. Another consideration is providing appropriate and adequate training to the people who collect the data. Also, there's the thing of partnering with trained and experienced statisticians or biostatisticians to make sample size calculations, determine appropriate formats, and analyze the data. So, if resources are available and it is appropriate to develop web-based surveys, a variety of survey development tools are available to support this process. Um, these um, these online tools include SurveyMonkey and other tools that are available. So the online tools provide easy to follow directions and various formatting options. So in addition, for computer distributed surveys, they may also offer appropriate distribution options. And once the surveys are completed and they are returned, and the tools offer some simple data analysis options and the opportunity to download the participant data into other data analysis software such as Microsoft Excel and SPSS, a statistical data mining and analysis software for analyzing quantitative data. So now let's now continue on the use of surveys. Surveys may be completed by self-administration um, in face-to-face or telephone interviews or through online distribution, either directly on the web or via email. Questionnaires are most valuable for collecting data from a large number of people. Considerations in the selection of the method include the type of information required, the population to be surveyed, and the financial resources, human resources, as well as the time that are available. So the type of information that is required often determines the approach to survey administration. And the more sensitive the information, the less likely some individuals are to want to discuss it and with another person. So an interviewer facilitated survey may be less successful than a self-administered survey. Face-to-face interviews may be appropriate with less sensitive questions. So obtaining information through interviews requires the interviewer to be tactful and to build rapport with interviewees. Both open-ended and closed-ended questions may be used in surveys that are conducted face-to-face or by telephone. Getting information from open-ended questions is less successful in a self-administered format. Telephone interviews tend to have less missing data and fewer don't know responses than self-administered surveys. Although building rapport for a good telephone interview may be difficult. A face-to-face interview will likely produce more valid information than a self-completed survey in populations with low reading levels. The resources available for the distribution of surveys or to conduct interviewer facilitated surveys may control the approach that is selected. Face to face meetings require additional time, training, as well as travel. Mail distributed surveys incur initial postage costs and postage for follow up and reminder postcards. Although the cost of distributing surveys by email is low, the likelihood of having wrong email addresses is high. Utilizing telephones may require high tolls for long distance calls. The most appropriate method for administering surveys is often based on the population that the survey is intended to reach. Participants who do not have telephones cannot be reached with a survey using this technology, of course. So a web-based survey cannot reach somebody who neither has nor uses a computer. And so the channel that is used for survey distribution influences the response rates and how quickly the study can be completed. So mail distributed surveys require an initial notification of the survey's arrival by letter or postcard and multiple reminders, which include further mailing or telephone calls to request completion of the survey. So recent access to computer technology has made emails and web-based computer distribution an option, but access to the various technologies may affect survey distribution and completion. When survey instruments are developed, and they are subjected to a variety of procedures to increase both their validity and reliability. Validity and reliability are standards for measurements, and they thus dictate collection processes. So validity is the extent to which a measure assesses the underlying concept that it claims to measure. On the other hand, reliability refers to the consistency of the measure when it is applied repeatedly. So reliability is assessed using internal consistency, split halves, and retest methodologies. Although reliability and validity are assessed separately, there is a relationship between the two that is worth remembering. For an instrument to be reliable, it must also be valid, but it can be valid without being reliable. And so it's important in evaluation to ensure that any tool that is used to measure a concept, a construct, or an outcome is valid. And so, as we have said, validity concerns the degree to which scores that are achieved and reflect the underlying construct. Three types of validity are generally associated with instrument development. And there's what they call construct validity, and there is content validity, and thirdly, criterion validity. So construct validity is the extent to which the measure is theoretically sound and correlates with the theorized construct. It measures phenomena that can be observed that reflect the underlying concepts. Content validity assesses the extent to which the items in an instrument are well defined and represent all the facets of a given construct. So experts may be used during the instrument development phase to assess the accuracy of the items that are selected to measure the variable of interest. A literature review or a qualitative research may also provide information to improve conceptualization and understanding of the variables and their impacts on the measurement. Criterion validity describes the concurrence of the item on or scale and with a previously assigned gold standard that confirms its predictive value. So in terms of reliability, when an instrument is developed, it is assessed for its stability in order to determine the level of random error that may be interfering with true measurement of the variable. So any error variability causes an underestimation or overestimation of the true measurement, making the assessment unreliable. So this variability is measured using a reliability coefficient, and that is at 1.0 when no error exists. So a range of approaches can be used to assess the extent to which there is variability in the collection and interpretation of the data. Intra-rater reliability assesses the extent to which the individual changes with each successive assessment. On the other hand, inter-rater reliability measures the difference between two persons assessing the same situation or the same data. Cohen's kappa is the statistical test generally used to assess reliability using nominal or ordinal data. Internal consistency is a measure of correlations across given items in a test. And Cronbach's alpha assesses the correlation among the total number of items on the scale and the extent to which they assess the same underlying concept. An instrument with a high internal consistency coefficient has an alpha of 1.0. An acceptable range for psychometric analysis of an instrument is 0.65 to 0.9. Test retest assessment measures reliability by using the same test and administering it two different times with the same sample. So to increase the validity of this test, the repeat test must be conducted within a short period of time and must record a Cohen's kappa of 0.8. An accurate definition of the target population and of the inclusion and exclusion criteria for the study participants are critical in any research study. The sample consists of population units, things, organizations, geographical areas, and so forth, and that have the characteristics of interest to the researcher. So it differs from one research study to another and is directly related to the evaluation question. For instance, a study of the relationship between childhood obesity and the intake of vegetables will likely focus on children ages 3 to 12, and while a study of substance abuse and teen driving may focus on youth 15 to 20 or 21 years old. So sampling is the process of selecting a small set or group of units from the target population. There are two main categories of sampling and two broad groups of sampling techniques. And these are the random or probability sampling and the non-random or non-probability sampling. The random sampling techniques are used when the resulting sample has to be representative of the population. Random sampling is used primarily in quantitative studies, such as surveys, because it enables the researcher to generalize the results to the population as a whole. A sampling frame is required, and that allows for a random selection of participants who are representative of the underlying population and being studied. So these approaches are used in designing experimental and quasi-experimental designs. Examples of random sampling techniques include simple random sampling, systematic sampling, cluster sampling, and stratified sampling. The non-random or non-probability methods are used primarily when the goal is to explore and reach an understanding about issues that pertain to a specific group of people. Although these methods are convenient for obtaining a sample for study, they rely on having captive audiences or on the particular characteristics of the population. For instance, it is impossible to randomly select a sample from a hidden or hard to reach population, such as illegal immigrants, drug addicts, or runaway youths. Although the bias in selection of participants is much higher when using non-random sampling techniques, and the method can still lead to valid statistical conclusions. Non-random sampling techniques include convenience sampling, purposive sampling, and snowball sampling, and they do not provide samples that are representative of the underlying population, and therefore results from them are not generalizable. So simple random sampling involves random selection of the participants in the study. It is achieved by selecting names or numbers at random and from a list of all potential participants, and with each having an equal chance to participate. Cluster sampling may be used to select a group or participants from a group or entity such as a business, a school, a faith community, a census tract, or a neighborhood. And the entire group or location can be selected, or a randomly selected number of participants may be selected to represent the group or the entity. Systematic sampling is an alternative strategy to probability and to simple random sampling. It is achieved by selecting names or numbers from a list, such as a voting register or a phone book, at the same regular interval. Stratified sampling is achieved when the members from a population group of interest are subdivided into strata and systematically sampled from a list of the population of interest. The sample that is selected is proportional to the size of the population type in the general population. So the sample size for data collection is determined by the research approach, the population selected, the needs of the study, the type of analysis required, the resources and the expertise available, and the costs. And so the size of a random sample, or the number of units on which data have to be collected, is computed based on several types or a type of information, such as the size of the population, if it is known, the amount of error in prediction that can be tolerated, generally 5%, yielding a 95% confidence that the study results are accurate, the effect size or the degree to which the groups in the study differ in the characteristics of interest for the study. For example, how much heavier kids are who do not have at least one intake of vegetable a day than those who do. And so the larger the sample, the more representative it will be, and the more power it will have for making accurate and reliable interpretations of the data. But the cost will be higher also. So sample size is generally computed to give the researcher a minimum of 80% power to detect a difference between groups, and yeah, if that exists. So in general, the more heterogeneous the population, the larger the sample size required for quantitative research analysis. The sample size is also determined by the number of variables in the study and the number of subgroup analyses that are proposed. If, for example, a survey was conducted as part of a study about workplace injuries at a treatment plant, a larger sample size would be required to understand the factors leading to the injuries if the analysis were conducted to provide subgroup analysis by gender, age, race, or type of occupation. So the sample size for a research study may be calculated based on a formula from a table, or calculated using computer programs such as Stata, SAS or EpiInfo. Detailed discussion of this topic about sample size calculation and can be found in textbooks. So before a survey can be taken, it must reach the study population. And it is important that the distribution method be sensitive to the cultural norms of the population and appropriate for the setting and the study. And so participants for a survey may be available in one place, or they may need to be individually recruited. So advertisements to recruit participants may be placed in flyers and other media. And people can also be invited to complete a survey contained within an envelope placed on a website, attached to an email, or through a telephone call. And recruitment scripts that are included with the survey distributed by mail, read over the phone, or included in an online solicitation must be developed and approved by a local institutional review board. Staff must be hired and trained to conduct telephone or face-to-face interviews for data collection. In an empowerment model, such training leaves communities with skills that they can use long after the evaluation. Training may include improving facilitation and listening skills, but always includes familiarization with the interview guide so that there is little or no change in its delivery from one interview to the next. Then consistent delivery increases reliability and minimizes the threat to validity caused by instrumentation. And before developing a survey, the first consideration is what is the research question and what information does this survey have to elicit? So if the answer is not available in existing data and a new survey has to be developed, then the next question is there a survey available that can be adopted or adapted? So answering the second question requires doing a literature search for peer-reviewed articles that contain surveys or results of surveys, and consulting with colleagues in the same or similar field, or scanning the internet. So in program evaluation, finding the right survey instrument can be difficult because initiatives are unique and have different characteristics, and the needs of each evaluation are different. So identifying the questions first requires identifying the indicators for the response. And this is achieved through the literature review. And in cases where there is little information about the phenomenon, brainstorming with experts in the field or conducting structured focus group interviews with a sample of the population. Indicators provide the evidence that a change has occurred. Examples of indicators include the percentage of participants reporting an increase in the number of minutes per day of exercise, the percentage of respondents registering under a newly implemented expansion of eligibility for health insurance. So the responses to questions in pre-post surveys that assess the participant's outcome in relation to the activity may be used as indicators. Identifying existing reliable and valid instruments that serve the purposes of the study, or compiling a new instrument using existing valid and reliable items from a variety of sources, and may be quicker than developing an instrument from scratch. So modified or new instruments should be validated with a sample similar to the study population in a pilot test. In developing an instrument, it is essential to keep in mind the potential respondents for the survey, the questions and question formats, as well as the data analysis methods. The persons required to complete a survey are a key consideration. So they will determine the language and the reading level of the survey tools. Surveys to elicit or to solicit information from Spanish-only speakers will have to be written in Spanish or translated into Spanish. By the same token, if reading levels are low, the survey must be developed at a third to sixth grade level in the appropriate language. Particular attention is given to developing surveys for children and adults who function at a lower cognitive level and who have less developed conceptual skills. They require more concrete questions. The Flesch-Kincaid grade level readability formula, developed by Rudolf Flesch and John Kincaid, may be used to assess the reading level of surveys. It is built into Microsoft Word and can be assessed through the spelling and grammar function. A survey also should be developed so its length does not burden respondents unduly. Survey developers must balance their need to know against the real life experiences of the respondents. We also have to consider the question formats. Survey instruments may contain closed-ended, open-ended, or multiple choice questions, or questions that provide 3 to 5 point scales for respondent feedback. Surveys may also ask respondents to match, rank, or compare a set of options. The response categories of closed-ended questions should be exhaustive, including all the possible responses, and should be mutually exclusive. However, because it is often not possible to meet these criteria, respondents can be given the option of writing in their own response by using the other category. So these answers are coded before data entry to allow for appropriate analysis. A survey instrument with closed-ended questions expects responses such as yes, no, ranking responses, and other numerical formats. The type of questions also determines the level of understandability of the items and therefore influences the response. Giving a yes/no response may be easier for a low-level reader than selecting a response on a 5-point scale of very unfavorable to very favorable. However, a survey with only yes/no responses provides limited understanding of the underlying concepts and limits the variability in the items. In addition, it limits the level of data analysis that can be conducted. It is important to field test the instruments with persons similar to those in the final audience to determine how well the items are understood and how well they produce the appropriate responses. In the next slide, we will see a table that has some sample questions with corresponding response formats. A useful addition to closed-ended questions in traditional surveys is the use of open-ended questions. And so respondents are asked to provide their own answers to the questions. And for example, respondents may be asked to explain the response they gave to a closed-ended question. So they may be asked a new question such as, what did you experience? What did you experience when you visited the site of the earthquake? So lines or a text box are provided for answers. Using open-ended questions as part of a survey provides for deeper understanding of the phenomenon, which is usually not achieved from typical survey research. And answers to open-ended questions may be coded before data entry to allow them to be converted to quantitative data. Uh, with regards to data analysis needs, the question format determines the types of data analysis that can be carried out. Nominal level data at the lowest level and allow for a distinction in mutually exclusive categories such as gender, male or female, or place of residence, house, apartment, trailer home, boat house. So when just two categories are given, as in yes, no, the values are dichotomous. And nominal data are used to calculate percentages. Ordinal level data allow rank ordering with categories and are represented by a number or a scale with no meaning other than the indication of a rank order. So ordinal data are used to calculate percentages and can also be used to calculate means. Interval level data have more meaning than ordinal data because the distances between the points have real meaning on a numerical scale. A commonly used example is the temperature scale, and where the difference between 80 degrees and 90 degrees is the same 10 degrees as the difference between 60 degrees and 70 degrees. Of course, that's the temperature scale in Fahrenheit or Celsius. Um, the ratio level data provides a true zero, unlike the interval data where there's no true zero, there's no starting point. So length, height, and age are good examples. Like the interval data, means and standard deviations can be calculated from this category of data and, and used to summarize the data. Because the type of data collected determines the type of analysis that can be undertaken. The questions must be designed to ensure that the appropriate level of data is collected. For example, if you are interested in having means, then the data must be ordinal, interval, or ratio data. And once the instrument is developed and those data are collected, only limited analysis may be possible if an inappropriate level of data has been used. For this reason, it is important to consult a statistician at the beginning rather than at the end of survey development. So there are steps in creating a survey instrument. When the research question is fully conceptualized through a review of the literature or an expert review panel or by conducting focus groups with the intended audience for the survey, you are ready to frame the specific survey questions. The survey questions are developed to reflect the information that is being sought. They have content validity. It is instructive to have content experts review the questions to ensure that they reflect the concepts that are being measured. Additional feedback from a statistician can ensure that appropriate question formats are used for the analysis. When evaluators must develop their own instruments, they can do so by following some steps. Step one is to state the evaluation research question and define the indicators that reflect the construct of interest. Step two is to frame appropriate questions, making them as clear and as simple as possible. The third step is to order the questions into an instrument that flows smoothly from beginning to end. Consult a statistician as needed to confirm the appropriateness of the response categories for the proposed data analysis. The fourth step is review the instrument for construct and content validity. Does it ask the question it intends to ask, and does it measure the construct fully? Have an expert panel review the instrument. Step 5 is check the instrument's readability using the Flesch Kincaid grade level readability formula, which, as we have said, is built into Microsoft Word, if required, to determine the reading level. Step 6 is pilot test the draft instrument with individuals or subgroups that are similar to the study population and you intend to go to. Step 7 is edit the survey instrument as needed. The eighth step is prepare the final instrument for use. An alternative approach to assembling a set of questions for a survey instrument is by reviewing existing surveys in the literature or by contacting colleagues or experts in the field. Using existing valid and reliable surveys or drawing ideas from them saves a lot of time. If you take this route, be sure to get permission to use the material or include a reference if it is a publicly available survey. Once the final set of questions is ready, the draft instrument is compiled into an easy to read, logical format, complete with instructions for completing the items. Difficult and sensitive questions and demographic questions can be left to the end. And once the draft survey is reviewed by an expert panel, it is ready for a pilot test. The extensive use of electronic communication such as email and web-based tools makes reviewing by an expert panel and editing questions a more practical and less time-consuming process than it used to be. Additional guidelines for survey development include make items clear and precise and short to the respondent so that the respondent knows exactly what the question is that you are asking. Avoid using items that contain more than one question and ask only questions that are important to the respondents and that are relevant to answering the research question. Avoid asking questions in the negative using words such as not. Ensure that concepts are clearly defined. Ensure that questions allow for a normal distribution of responses or a 50-50 distribution in the case of dichotomous answers. Use as large a number of answer categories as possible to provide variability in the responses. Avoid using questions that result in the respondent responding to the question in a particular way, either negatively or positively. So here we see a table with sample questions and possible responses. For a question such as, do you know about the recent changes in the policy to increase eligibility? The response could be yes or no. And then if we ask respondents their opinion as regards a statement such as, changes in the policy improved access to healthcare for residents of my county. And the possible responses could be on a 5-point scale, ranging from strongly disagree to strongly agree. And participants could be asked to check all the options that apply in response to a statement such as, the clinic that we recently opened in your community offers the following services. And respondents may be asked to provide their age in years or choose from a list of age groups if asked how old they are. Pretesting an instrument is a chance to determine whether it works under real life conditions and whether it works well in the population for which it is intended. And so do a pretest with a representative number of participants drawn from the same sampling frame as the one used for the study. Participants in the pretesting must be similar to the study participants. So pretesting is a miniaturized walkthrough of the final survey design. Pretesting provides an opportunity to determine whether the instrument is culturally appropriate, is written at the appropriate reading level, is short enough so as not to burden the respondents, and is written so that the questions are interpreted by the respondents in ways the researchers intend. So pretesting also provides opportunities to test the flow of the questions and to time the entire procedure, including administering the consent form. It provides data for instrument validity and reliability tests and is a way to solicit feedback. When the pre-testing is complete, the survey instruments are revised and edited as necessary, and they are ready to be rolled out. So pre-testing provides information on the clarity of the questions, the clarity of the response items, and questions that respondents could not answer or choose not to answer, the clarity of instructions for answering the questions, and the alternative responses that the respondents may provide that are not represented in the survey. And so using an order category allows for respondents to provide additional possible answers for the final survey. So another value in pretesting beyond the field testing the survey is to field test the entire process and test the prediction and that the intervention could and that the intervention caused the outcome and that is observed. Evaluators should not be confined to using only one method if the research can be appropriately conducted using a combination of approaches. And so using a mixed method approach and multiple sources of data or varying data collection methods to cross-check and substantiate findings and increase validity in evaluation research is known as triangulation. And so primary and secondary data can be used to answer the same research question. And they provide complementary or different perspectives. And primary data sources include people directly affected by the problem and people implementing initiatives and services to address the problem, people knowledgeable about the problem, and people observing the behaviors or conditions that influence the problem, as well as influential members of the society, such as policymakers and community leaders. Secondary data sources include existing local, state, and national databases that provide behavioral, environmental, and health statistics. So, in addition to using a variety of sources of data, a mix of qualitative and quantitative data collection approaches may be used to achieve triangulation. A matrix may be used to think through the selection of the most appropriate approaches, and the final selection can be based on considerations of appropriateness, expertise, and resources. The planning process can help delineate um, these factors for decision making. So during the data collection process, the rights of individuals must be respected and their welfare must be protected. It is also important to protect privacy and confidentiality in data collection and in reporting the results. Protecting the rights of an individual requires that researchers do not coerce anyone to participate in a study. In addition, participants have the right to know and understand all the research procedures. If they consent to participate, they must be treated in a caring, considerate, and respectful way. All their interactions must be kept confidential, and their data must remain anonymous unless they have been notified otherwise. Specifically, the American Evaluation Association identifies respect for people as a guiding principle for evaluation practice. And a quote from the document says, evaluators respect the security, dignity, and self-worth of respondents, the program participants, clients, and other evaluation stakeholders, and thus should abide by current professional ethics, standards, and regulations regarding confidentiality, informed consent, and potential risk and harms to participants. So an institutional review board, or IRB for short, is a panel of individuals who represent both the research institution and the community. The board reviews research proposals and provides guidelines about informed consent documents and ensures that the research does not have the potential to harm research subjects. Requests for IRB review must contain the full research proposal, the data collection instruments, the consent forms, recruitment materials, and information provided to the study participants. Consent forms contain a description of the research study and information about risks and voluntary nature of the study and the confidentiality of participant information. And they specify the benefits of participating and the contact information for an independent institutional representative whom the study participants can get in touch with if necessary. So informed consent forms must be read by or read to the participants and signed by both the participants and the researcher. Consenting to participate in a research study is also required to be culturally appropriate. Alternative approaches must be sought when necessary. Information provided to the participant in the consent form includes how confidentiality and anonymity of respondents' identity and responses will be maintained, and so on. So, informed consent form should include certain elements such as the purpose of the research, the expected duration of the subject's participation, the number of people in the study, a description of the procedures, a description of any foreseeable risk or discomfort to the subject, a description of the benefits, an assurance that records will be confidential, and a statement that participation is voluntary and the participants can decide to withdraw at any point in time, a description of the compensation provided, if any, and the contact information of the evaluator or the researcher. So members of research teams are required to complete training on the protection of human subjects during research and to be familiar with the guidelines of the Health Insurance Portability Act, HIPAA for short. So stakeholders provide insights into ensuring the data collected are both reliable and valid. They provide information on the methods that are most appropriate for their community. They may facilitate the data collection process and collect the data themselves in some cases. So stakeholder participation is critical for ensuring that the sample population is knowledgeable about the study and is willing to participate. In small communities, previous knowledge of a research activity will often facilitate or hinder data collection. Information about the evaluation can be provided in community meetings and in the print and electronic media. It is important that the potential respondents understand the value of participating in the study. In community-based participatory research, members of the community may be trained to collect the data. In many communities, this may serve as an advantage as they already have knowledge of the community and an understanding of the issues. As in all well-designed research studies, it is important to minimize the risk of bias in the data collection and the threat to validity, known as instrumentation. And so adequate training of enumerators and facilitators is critical. It's also important to understand that members of the community may not be the most appropriate people to collect sensitive and personal information. A balance must be struck between using members of the community and collecting valid and reliable data. In some cases, using outsiders as data collectors may be preferable. A conversation with the stakeholders may help clarify any issues that arise in the process of data collection. So in summary, the validity of the evaluation relies on the sample characteristics, the research methodology itself, and its cultural appropriateness. Answering the question involves using an appropriate mix of data that are gathered from and about the people who benefit, who provide the goods and services, or who are somehow influenced or affected by the initiative. The selection of the method for data collection and data analysis depends on the research approach that is adopted, the expertise and skills of the evaluator, the resources available for the evaluation, and the costs. Surveys developed to collect quantitative data for evaluation may be administered by a variety of methods that must be sensitive to the context, the population, the type of data, and the type of analysis needed. And quantitative and qualitative data are both appropriate methods for collecting data to answer evaluation questions. And together they provide scope and depth to the findings. And using both primary and secondary data is also useful in providing complementary or different perspectives. Consent forms contain a variety, a description of the research study, and information about the risks, the voluntary nature of the study, and the confidentiality of patient participant information. They specify benefits of participating and contact information for an independent institutional representative whom the study participants can get in touch with if necessary. Thank you very much and see you in the next lecture.